Tammy. Well, I understand how you feel because I've oftentimes heard that comparison. Not quite like buying a house, thank goodness, but perhaps like buying an inexpensive car. Um, we, you never know though, Tammy. It just depends on exactly what your needs are. Some of these implant solutions aren't nearly that expensive, and of course, others are. So, first thing you have to do is determine exactly what your need will be. Then once you do that, I understand the need to try to determine where you can get the best value for what you're going to have done. I think that's a reasonable thing for all of us to do. When you talk about going to Mexico or other areas for dentistry that are outside of where you live, we generally call that destination dentistry or destination medicine. The illusion about that sometimes is that that's going to be of a significant cost savings. And the reality is that many of the cases that I see are from patients who have had that kind of care, and who knows where they might have been, Mexico, of course, being one of the possibilities. The restrictions, the rules, the regulations that they're expected to follow in those countries are not like they are here. And consequently, we see some pretty significantly poor outcomes. And when those outcomes have to be dealt with, the cost of dealing with them exceeds the original cost of having it done, oftentimes 2 or 3-fold. And you end up with nothing. You started with what you had, you end up with a situation that's worse than what you started with. Then you have to try to do something about it. So by the time that you finish with that kind of care, it isn't unusual to see it costing you 3 or 4 or 5 times what it would have cost you had you originally done it where your home is, whether that's in Houston or whether it would be in Dallas or Austin or wherever it might be. The other thing you have to consider is any dentistry that you have done, implant dentistry with the restorations on it, those are not things that are going to last forever. The implants have an excellent opportunity of lasting your lifetime, but you're going to have to build teeth on top of those implants. And those teeth are a little bit like perhaps tires or brakes on a car. With time they wear out and you're going to have to replace them. And before the replacement, you will oftentimes have to have a repair from time to time. If you've not had that dentistry done at your home, the travel expense and difficulties of trying to get back to where you had the original work done can be extremely difficult, extremely expensive, and just terribly inconvenient. So it would be very unusual for me to recommend to anyone that they have dentistry done significantly outside of where their home is. I hope that helps, and I hope it's not too disappointing, but I certainly wouldn't recommend it. I would suggest that you do what you need to do to get a solution close to home. Hope that helps, Tammy.